Depression is characterized by two main symptoms that are required. So number one, you have to have some kind of decrease in energy or motivation. And then number two, you have this fancy word, it's called anhedonia. So anhedonia means loss or interest in activities that you would normally find pleasure in. So you have to have one of those symptoms. But in addition to that, patients generally see that it affects their appetite. So they'll either have a decrease in appetite or an increase in appetite. It affects their sleep, so they're either sleeping too much or not enough. Once again, affects those energy levels as well. So it can affect multiple areas of your life. Depression is defined by sadness, but also in combination with those symptoms we talked about earlier. And this generally has to last for a period of 2 weeks or longer. Being sad is a mood that you might be in, and that's generally more short-lived. So you would be sad for a period of maybe a couple hours to a day, but that wouldn't persist like depression that would persist for weeks. Some signs and symptoms of depression are decreased energy, decrease in motivation to do things, loss of interest in activities that, the person would normally find pleasurable, such as painting or drawing, taking walks out in nature, or engaging in playing an instrument. Also can affect your sleep. So either you're sleeping way too much and don't have the energy to get out of bed, or you can't sleep at all. Other things that depression can affect would be like your appetite. So some people don't eat at all and feel like they can't eat, and others they eat as a way to kind of comfort during depression and eat more than they should. Depression is diagnosed by we use something called the DSM-5. That is the criteria. It's the book of all of our psychiatric diagnoses. But it says for major depression, the patient has to have one of the following symptoms. So there's two major symptoms. Number one, loss of energy and motivation. And number two, they have to have anhedonia. So that's just a fancy word for losing interest or pleasure in activities that you would normally find enjoyable. And then also, patients have decrease in energy, motivation, they have loss of appetite, either sleeping too much, not sleeping at all, and generally that's persisting for a period of 2 weeks or longer. We have a couple of tools. Number one is the DSM-5, which is a catalog that runs through the diagnostic criteria that we can go by. But we also use versions of the PHQ-9 score or PHQ-10 score, and that really tells us how severe your depression is. So the higher the score, the more severe the depression. And a lot of times during our treatments, we're actually utilizing this scale to track how patients are progressing in their treatment. Treatment-resistant depression is depression that has not responded to one or more oral antidepressants. So we always first line treat depression with an antidepressant most of the time. And that is with one of the classes, either an SSRI or an SNRI. When we try these medicines and they're not working as well, then we go to alternative options to treat that depression, and that depression can be labeled as treatment-resistant depression. We have two modalities that we utilize in our clinic. The first is TMS, or transcranial magnetic stimulation. The other modality that we utilize is Spravato, or S-ketamine. S-ketamine is a nasal spray that's inhaled that's FDA approved for the treatment of treatment-resistant depression. So depression can be more prevalent in women just because there is a hormonal component. So women are going through their menstrual cycle. There's actually a diagnosis that's known as premenstrual dysphoric syndrome, where we have more depression and mood symptoms. It's also common after women of childbearing age have a child, they can experience postpartum depression as well.